Welcome to the Heroes Initiative powered by ITCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by ITCA. Doctor, now we are focusing on cataract surgery pre and post-operative care. So doctor, my first question for you is, what should I expect during the pre-operative assessment for cataract surgery? Are there any specific preparation do I need to make, doctor?
Yes. So once it is decided that patient or you have to undergo cataract surgery, there are a set of things which we do or which we prescribe before cataract surgery. One important thing is we have to make sure that you need cataract surgery. Once we give you a date, there are certain investigations which needs to be done, like blood sugar, ECG, viral markers, and sometimes patients have other illness. We get their KFT and other investigations. That depends from case to case. Besides that, we tell our patients to keep their eyes clean, stop using any eye makeup 3 days prior to the surgery. We start topical, which means eye drops, which are antibiotics, 3 days prior to the surgery to kill all the microorganisms which are there, which can cause infection later on. And on the day of the surgery, we tell our patients to use dilating drops before they come to us. And besides that, whatever normal medication they are taking, like for blood pressure, blood sugar, or blood thinners, we always tell them to keep on taking the drugs which they are taking, systemic drugs, oral drugs, unless in some patients, we tell them to stop their blood thinners 5 days prior to the surgery, but that too in consultation with their treating physician or cardiologist. And these are the things which are very important. Once these things are done, then only we go ahead with the surgery. And on the day of the surgery, once the patient is coming, we tell them to have a light breakfast. So for cataract surgery, you don't need to be fasting. You can take light breakfast. Take a head bath on the day of the surgery or a day before surgery, because after the surgery, you are not allowed to take head bath for 1 week. Although you can take a bath below neck, but then head bath will only be allowed after a week. And I think that's most of the things which we tell our patients pre-operatively.
What are the most important post-operative care steps to ensure a smooth recovery after cataract surgery, doctor?
So as we know, cataract surgery is a very simple surgery nowadays. It is done. It's a simple surgery which needs very high precision. So surgery takes around 5 to 10 minutes, but then this surgery is done without injections nowadays. So post-op precautions are also not very demanding. The most important thing is what we tell our patients is not to let water or dust fall into their eye for 1 week. For that, we give them dark glasses. They can start watching television or mobile from next day onwards. Nowadays, this is a very advanced surgical technique which we use, micro-incision cataract surgery. And after that, they don't need to take many precautions. But yes, most important thing, as I said, not to let water or dust fall into their eye. They can start exercising a week after the surgery. For 1 week, we tell them just to, if they want, they can just walk. But all yoga, breathing exercises, lifting weights have to be avoided. We tell our patients not to do kitchen work or household work for at least a week. All these things are done because we don't want any small accidents. So if something falls in the eye while sweeping or while cooking, then it may cause serious issues. So these are the precautions in the nutshell.
Agreed, doctor, what you said. Are there any common complications after cataract surgery and how they can be managed or prevented?
So cataract surgery is one of the safest surgeries of the body. Like all the surgeries which are done from head to toe, cataract surgery is one of the safest and has the least complication rate. So it's a very uncomplicated surgery. Yes, complications do happen, but the risk of complication is very, very low. It is a very safe surgery, as I said. And to reduce the complications, we make sure that patients' blood sugars, blood pressures, and systemic parameters are under control before the surgery, so that post-operatively there are lesser chances of complications happening. And We give antibiotic drops prior to the surgery to reduce the risk of infection in the eye later on. And during surgery also, we give antibiotics in the eye and to reduce the risk of infection. Post-operative time also, we tell them to take adequate precautions, as we discussed earlier, to reduce the risk. Yes, complications do happen once in a while, but we manage the complications ourselves. We have a team, whole team, like cataract surgeon, retina surgeon. If the complication do happen, we manage at the same sitting only.
So doctor, your expertise and insights on cataract surgery pre and post-operative care are invaluable to this initiative, and we believe your participation will greatly benefit the patients.